Visit abaeservices.com for fast medical transcription service. This podcast episode is brought to you by AB Music Creative.
This episode is brought to you by Dr. Lourdes Capulong.
What's the difference between now and when you started? Now would be 2023 when we're doing this taping. But what's the difference now as opposed to decades ago?
Yeah, that's a great question. It's almost like I planted you with that, but for the audience, I didn't. Well, the reason it's a great plant question is because there was an enormous revolution in technology in the field of radiation oncology that happened right around the year 2000 to 2002. And when I was in medical school and when I was a resident, our technologies in terms of aiming where the beam went was pretty rudimentary, and our technology to shape the cloud of radioactive energy that goes inside of a patient was fairly rudimentary. But now...
Can you explain that further? Like, is that more like 1:1? Point it here.
Let's just say you have a lung cancer.
Yeah.
Okay. In the olden days, I would basically take an x-ray picture, and then I'd take literally a wax crayon, and I would draw on that x-ray picture the shape of a lead block that went into the machine. So the only amount of radiation that came out of the machine was a hole in this lead block that conformed to the shape of your tumor. And there'd be a beam from the front and a beam from the back. And that's really the extent of what we did.
Right.
But now what we can do is, and the technology is way too advanced to talk about it on the podcast, but we now have the ability to shape a cloud of radiation that goes inside of a patient's body that perfectly conforms to the shape of that tumor and leaves very little radiation deposited elsewhere. Oh. And that allowed us to very safely escalate the doses that a patient can tolerate. And so we're killing a lot more cancer than we did 25 years ago with a lot less toxicity. And so it's just an incredible leap in technology that happened. And another thing that happened is we can now aim the radiation beam much more precisely, because a tumor can move around and daily positioning of a patient isn't always precise.
Yes.
But now we have the ability to look inside of a patient every single day and say, where is this tumor today? And then shift the x-ray beam. Because in the old days, we had to create x-ray beams that were bigger than the target area.
For the margin of error,
Exactly, to accommodate for any positioning uncertainty.
Yes.
But that greater x-ray beam size caused a lot more collateral damage.
Yes.
And it also limited the dose that we could safely deliver.
Because of the collateral damage it may cost, right?
Exactly. But now, because the x-ray beam is smaller, there's much less collateral damage, and so the patient tolerates the treatment better, but we can also drive the dose higher and cure more people.
Speaking of cure more people, a while ago while we were having lunch, and my little 8-year-old daughter had a nice conversation. We were starting with COVID, and then she goes, does COVID still exist, right? That's what she said. And your answer was, well, right now it's like the flu. That's paraphrasing, but that's very optimistic, because I lost my mom to cancer, and my wish is for someone like you to say that in the future, that, cancer, you'll be well tomorrow. Fortunately, we do have friends who've had cancer and now they're all in remission, a decade in remission, 2 decades in remission. But what's your take on it? How optimistic are you, if you even are?
Well, your question's getting at an age-old question that I hear a lot, which is, when are we going to cure cancer?
We are curing cancer.
And that's the reality. It's like COVID, right?
Yeah.
There are still some people that get COVID and they get sick, but most people get COVID and they just get over it.
Amen.
Will there ever be a day that nobody dies from influenza and nobody dies from COVID? Probably not.
Yes.
Will there ever be a day where nobody dies from cancer? Probably not.
Amen.
But we're making progress decade by decade. We're slowly chipping away, and it's not just at treating cancer, but we're also learning how to screen for cancers and help prevent cancers.